and can you go in the chat box right now and just type in your name, and if you are a parent, an educator, a community member, whatever brings you here today so we can get to know you a little bit better. And as we go along, feel free to add any questions you have to the chat box. And we'll also have some resources in there as the night goes on too. Here's a list of some of our upcoming trainings. We have the next one is April 13th is on benefits. And we will have a benefit specialist here to talk about the different systems. On April 27th, we will have representatives from MATC and UW Whitewater and a former DeForest High School graduate who is currently attending Whitewater and his family to talk about what the differences are between high school and college and what students and families need to be prepared for. May 11th, we'll talk about guardianship and supported decision making. We will have an attorney here who's also been through the process with his own son. And on May 25th is our wrap up, and we will have Family Voices here. We'll be presenting a presentation on what is after high school. And that's just going to be a time where we, wrap everything up and provide everybody with some additional transition resources. All of our presentations are recorded, like I said, and all of the resources can be found on the Children and Youth with Special Healthcare Needs website. So for tonight's presentation is Hunter and Tim Markle. Tim is a parent, a representative of the Wisconsin Youth Health Transition Initiative, and the director of the Children and Youth with Special Healthcare Needs Southern Regional Center. And he has been a huge part of putting these transition nights together. So we're very excited to hear Hunter and Tim and their journey with healthcare.
All right, well, thank you so much, Melissa. It is awesome to be here. Our plan is to go through sort of a presentation that we normally have, but we want to be able to have time for any questions, or we will do our best to watch the chat. But we are just really excited that you are here tonight, and we're excited to talk a little bit about what we've learned over the years. I wasn't born with any of this knowledge. How about you?
Nope. No. The only knowledge I was born with was how to cry and make my parents mad at me for crying.
We did not get mad at you for crying.
Could have fooled me.
Yeah. Okay, so that would be my son Hunter. So let me go ahead and let's share the screen and see if we can get this night going.
If it all works out, because technology doesn't sometimes. Oh, hey, it's actually working.
All right. So my question to y'all is, do you see the regular screen or the presenter screen? If someone could just let me know in the chat, because I never know what the other people are seeing. That's what I was afraid of. Okay, hang on. Oh, Now, how are we doing?
I meant to say it was the presentation screen. It looked good.
Oh, okay. And Lisa has both because she's special. Okay, so I need to switch this back then. And you know what? I'm actually going to make this really easy on everybody and just hide the presenter view. Okay, so do you still have a PowerPoint? Yes, thank you very much. All right. Well, let's get going today. So you already know who we are. Do you want to say anything else about yourself?
Not at this point in time because we should save that for a bit later.
Okay, we'll save that for a bit later. I do need to let you know that I am presenting as part of the Children and Youth with Special Healthcare Need Network in Wisconsin. This includes the Southern Regional Center for Children and Youth with Special Healthcare Needs. There are how many regional centers in Wisconsin?
5.
5 regional centers in Wisconsin.
I originally thought there were 4.
No, there's see the colors.
Yes, I know, but I thought Milwaukee was part of the same South Central
Oh,
review.
yeah, I
and
could
everything
see
for a
that.
while.
I could see that. So, yep, so 5 regional centers throughout Wisconsin. We also are affiliated with Family Voices of Wisconsin, fantastic advocacy organization. Absolutely would love to have you back at the end of May to be able to listen to their What's After High School. Parent to Parent in Wisconsin is a parent matching organization there to support parents on the journey. We also have partners dealing with Wisconsin Medical Home, the Well Badger Resource Center, which is a statewide resource, and then ABC for Health that is there to help us with health benefits questions and Medicaid and stuff like that. And then the other place that I work with is the Health Transition Wisconsin. So Health Transition is one of 2 national performance measures for children and youth with special healthcare needs in the United States. So we are in good following with the other states that are working on health transition as well. So there is our 5 regional centers. Encourage you to get to know who your regional center is. You will find we will provide a link to the regional centers at the end when I send out the presentation. We'll get this out to you tomorrow. So let's talk youth health transition. So it's known as Youth Health Transition Wisconsin, or the Youth Health Transition Initiative, which of course makes me think of a
Yeti.
Yeti.
Even though he continually uses the abominable snowman.
But
PMG. I don't.
I don't know which he is, but he's cute.
He's adorable.
Okay,
Yes.
so he's
also, keep track on how many times those appear. You will not be getting a prize, but it is fun.
That's true. So the Yeti does appear throughout the presentation,
Yes.
basically to keep us interested.
Entertained.
Yeah, exactly.
Well, everybody entertained.
Oh, okay. It'll keep us all entertained. So Health Transition Wisconsin, the purpose is to ensure that high quality, developmentally appropriate healthcare services are available in an uninterrupted manner as the person moves from adolescence to adulthood. So this is one of those transitions that can sneak up on students, and it can sneak up on families and on parents, because there's so much happening during transition between trying to decide, what do I want to do after high school? How long do I want to stay in high school? Where do I want to live? That sometimes health transition gets forgotten. And it's really important because some of our youth with special health care needs need that continual care. Is they need to see that doctor uninterrupted, or some very negative health outcomes could occur. Bad things could happen, and we don't want bad things to happen. And so we encourage people to start thinking transition at an early age. We talk to providers and schools and youth and families that really transition can start as young as 12 with some of the skills that we'll be going over today. And then in addition to the transition, what we have is a transfer of care. This is when the youth is officially done with the pediatrician or done with the pediatric system of care, and they are moved into the adult system of care. Sometimes that means a change of doctor. Sometimes it means a change of clinics. Sometimes it means a change of specialist. Is each person's journey is individual. So there could be a lot or a little, but there's always going to be some sort of transfer of care into an adult system. So what do? We exist to support healthcare providers and organizations to help them implement transition efforts. We have a learning community. We've got a cool website. We do trainings. We do outreach. We used to travel around and do exhibits, but we don't anymore. Now we sit inside our dining room.
Yep, pretty much. Thank you, COVID.
There you go. And so today we're going to talk about what is health transition anyway. We're going to talk about a readiness assessment, because it's good to know where you are if you want to get somewhere. If you're going to know where you want to go, you got to know where you are. We're going to show you 8 tools of healthcare transition. Hunter's going to talk about how he's did. how Hunter
Transported.
the healthcare transition, the tools, how he's used the tools. And then hopefully we'll have time to discuss ways, ideas that you have to help youth transition healthcare as well, and help youth become advocates, because that's really what we're talking about, is who is going to be in charge of healthcare decisions. And we want the person, the youth, to be as in charge of healthcare as is safely possible. And so,
Advocacy.
yeah, self-advocacy. Good job. So let's start talking a little bit.
Yay.
Say hi to Yeti. Hi, Yeti. Do you remember that picture, Hunter?
Yep, that was taken up in Door County.
Okay, and so we are up in Door County, on a lake, is that right?
Near a lake,
Near-
technically.
Okay, so near lake, that's right, we're out on a pier.
Yep.
And how excited were you to go out onto that rock and stand that close to the water?
Pretty much I did not want to get on top of that rock at all. And yes, this Yeti is technically a friendly one.
Yes, it's a friendly bumble.
Very friendly.
So you didn't want to go out on the rock
No.
initially. You were a little scared, actually,
Oh, terrified.
to go out on the rock. So, of course, we're looking at how to get you out on the rock, because I thought it would be really cool to stand there and get this picture. So did I just like push you out on the rock? Did I pull you out there?
No.
How did you manage to get out onto that scary rock?
Little by little.
So do you remember the steps that we took?
Slowly but surely, just one foot in front of the other, pretty much.
Yeah. So we spent time walking around the pier.
Yep.
Getting used to the area, looking at the rock, seeing how safe it was, looking at all the fun drawings. I would go out there. Somebody else would go out there, show that it's safe, that
Yep.
it's not slippery. And
Yep.
then slowly but surely you made your way out.
Yep.
So-
And fun fact now, that said rock is under the water.
Very true, is the lake level has risen and you cannot stand on that rock anymore unless you want to get yourself very, very wet. So to get out onto that rock, there was a process that we took.
Yeah.
Is you didn't just happen to go out there, and I didn't
No.
just force you out there.
No, you didn't.
And that's the same thing with health transition.
Pretty much, yeah.
It's a process.
Yep. It's just one foot in front of the other.
Well, we're going to hear a little bit more about your process, your story. But first, let's talk. Lauren, I love it. I wish we had a Yeti for you,
Yeah.
because that sounds like fun.
It really does.
So healthcare transition is the process of changing from a pediatric to an adult model of care. And as I said before, we're not alone in this. This happens all across the United States. It happens across the world. It's something that a lot of people are beginning to focus on because it's really important. So who needs to think about transitioning?
Pretty much everyone, but mostly kids going into their later teenage years into young adults.
Yeah, so those teenagers heading into young adults, and especially those kids who identify as having a disability or a healthcare need.
Yep.
Is that continuity of care, that constant seeing of the doctor is really important. Why is health so important? What do you think?
Well, beyond what is on the amazing slide you friends and coworkers put together, possibly, I have no idea if you fully put this together or not.
It was a group effort.
Okay, thank you. Just wanted to confirm that. Beyond everything there, it is mostly just a way to become a self-advocate as well. Because if you start self-advocating yourself through health, you can start advocating for yourself in education, working in everyday life and everything, and actually being who you want to be. And healthcare is the first step along this road and everything, along with transition.
So how do you think do you have any ideas on how health can increase someone's independence, or how not taking care of your health could harm independence?
Well, by not taking care of your health means you would possibly have more trips to the hospital, get stuck with possibly a in-house nurse and everything, or even go to a I don't remember what they're called actually now off the top of my head. Not a retirement home, the other.
Assisted living?
Thank you.
You're welcome.
That's what I was thinking of. But if you prioritize health in a healthy manner, the possibilities of that will slightly lessen, but it will still always be a possibility because we know nothing about the human body and it's all in its gloriness.
It is amazing. So health increases our independence. Being unhealthy decreases that independence.
Oh, 100%.
And then how about in everyday life? How does your health help you? How does being healthy help you succeed?
Beyond being able to get up out of bed to have fun staying at home watching television.
You have a lot more choices when you're healthy, huh? You could
Yeah.
do a lot more.
Yeah.
Cool. And then opportunity for secondary education and working.
Yep.
So you've done the college thing for a little while. You've done the working thing for a little while.
Yes. College still technically am in, but have not registered for any classes.
That's okay. You'll get back there. But how does your health play into school and work?
Basically, for schooling, it means you can actually do your homework.
Yeah, it helps you do your homework. How about attending classes?
100%.
And how does it affect your working?
Being able to actually make money to afford healthcare.
Yes, if your employer doesn't provide healthcare, you have to earn money to be able to pay for healthcare. And so working, you get paid when you work.
Yep.
And so the less you work, the less you get paid.
And the more bills you stack up.
That's right, because that's part of life. We'll be talking a little bit about adulthood in a little while.
Yep.
So health is more than just healthcare.
Yeah.
It's more than just seeing your doctor.
Yep.
It's really foundational to having a successful life, to having a full life, as you put it, a life of self-advocacy where you can advocate for yourself.
Correct.
Awesome.
And I got stuck there for a bit.
All right, pop quiz. In general in America, what happens at age 16?
Driving, which I was not able to do because I had to do it 3 times.
You are not alone in that.
No,
I don't know if I've ever counted up the number of times I had to take my driving test.
more than 4.
Yeah, it was a lot. So yes, most kids look forward to driving at 16. You didn't exactly drive right at 16 though. You took your time.
No, I took my time
Why'd you take your time? Do you remember?
because I didn't want to crash the car.
Yes. Didn't want to crash the car, and you didn't want to have your license until you were comfortable driving, which I thought was really, really smart of you.
Yep.
So, and do you remember during when we were out doing a lot of practice driving, do you remember who had more accidents, you or me? Yeah, I think I had one more accident than you did actually practice driving.
Oh,
So,
100%.
yeah, that was a fun icy day. What usually happens at age 18?
Voting.
And is voting important?
Yes, if you want to actually do something good.
And there are things,
Helpful.
and there are things that are important to people with disabilities and special healthcare needs.
Yep.
And we need to vote for people that will help us to
Yep.
have that best quality of life possible.
Yep.
And then age 21.
Drinking responsibly.
I'm so glad that you remembered drinking responsibly. That's good. I'm glad you remembered the word responsibly. Now, all these things are really important, but they usually lead up to this whole sense of you become an adult.
Yay, adulthood.
Adulthood. So at age 18, you are legally an adult.
Yep.
You are responsible for your decisions. You can enter into contracts. You can get sued.
Yep.
You are thought to be the decision maker in your life.
Yep.
Do you make your own decisions 100% of the time?
More like 65% of the time.
Do you know how many decisions I make 100% of the time?
None.
I always need help. Thank you. Very few, as I am always asking other people for input to help me make the right decision.
I mean, we have an entire team to help us with healthcare. So
That's
it doesn't
true.
surprise me that you need more help than just them.
I need a lot of help. And so
We all
when we are talking about becoming an adult and the responsibilities of being an adult and taking charge of our own healthcare, taking charge of our own lives, it's really important that we try to stay a step ahead so that we don't get to 18 and all of a sudden have to figure it all out. What can we learn before 18 so that we can be successful after 18? And so we're going to talk about a couple of steps, a couple of tools that you can use at different ages, so that healthcare can start, the transition can start at age 12. So let's talk a little bit about some tools and some resources. Number one is a readiness assessment. So a really fancy term, but basically a readiness assessment is just looking at what are some of the things you need to know. Do you need to know them, or is it something that you are actually going to use, that you're actually going to need to know, or is someone else always going to make that decision for you, which is fine. Everybody has their own journey. If it is something that you want to learn and that you need to learn, how are you going to learn about it? So where are you going to find those skills? And so the example on the board is from our friends at Got Transition. They have a number of different transition readiness assessments. They have them for a majority of the kids. They have links to different organizations, diagnosis specific transition assessments. Like there's some special considerations if someone has diabetes that they need to take into account for their healthcare transition. They have some for people that might have an intellectual disability to try to help them understand a bit more the extent to which they can be in charge of their healthcare. But what's really cool, Hunter, is that there's a form for youth and there's a form for parents or caregivers.
Is there a form for teachers and principals yet?
You know what? Thank you for asking that, is they just came out with a transition readiness assessment and ways to use the assessment and put it into the individualized education plan. So you can put healthcare goals right into your IEP and be working on them with your school team.
Glorious.
So that is just new on their website, which I'm really excited about because I want to see how we can get more healthcare into the post-secondary transition plans and into individualized education plans.
Now, if they only had one for basic healthcare clinics.
Well, we encourage the healthcare clinics to use these as well, to hand them out to their families, to their youth, to have them go through it so that as they come back every year, they can start working on, okay, at 12, maybe we can start explaining about the healthcare needs, explain what your diagnosis is, what your health is, understand your allergies, until finally we work down to, you know how to use your insurance, you know what doctors to see with your insurance. And so again, it's a process that we just build step by step. We build up those skills.
One foot in front of the other.
That's what you said in the beginning.
And I will continue saying it.
So the other thing, so these readiness assessments are available at Got Transition. There are other readiness assessments out there as well, but we really like these as a tool. We really like them as a tool for the youth to take and the parent to take, compare so that everybody knows what each other knows. And then also we encourage the healthcare systems to put it somehow into the medical record so that it could be continually referenced throughout adolescence, so that again, we're not hitting 18 and all of a sudden going, it changes, what am I going to do? But that we're prepared for that we're a step ahead.
Yeah. Stop right clicking.
I know, I don't know why I do that. They also do have some Spanish resources and Spanish language assessments as well. So let's talk a little bit about healthcare tools. Why? Because that's why you're here tonight.
No, say yes.
I mean, so far I really enjoy talking to you, but basically let's talk healthcare. So
Yay.
these tools are all on our website. There's also a workbook that goes with one of our trainings called Build Your Bridge, which is designed for caregivers and family members of kiddos with special healthcare needs that are transitioning. We also offer a training called Bridging the Gap, which is very similar to what we are doing here tonight. We offer training for physicians and clinics so that they understand about the healthcare process. And our newest one is called Dreaming Differently, and it's designed for parents and youth that are part of like complex needs clinics. So their transition looks different than other people. So we really wanted to speak to where those families are at. All right, let's talk tools.
Yay.
Let's talk adult providers.
All right.
All right, so how old are you?
23 going on 24 this December.
And how long have you seen your current doctor?
Since I was about 15, 16 years old.
Do you remember that story, how that happened?
Pretty much you asked my pediatrician at the time to be more one-on-one, and he was just simply like, why?
Yeah, I was encouraging him to spend alone time with you so that you understood that he was your doctor and that healthcare was about you. Do you remember how it used to be back when we go see the pediatrician together and he would look at you and ask you a question? What would you do?
I would look at you.
Yeah, exactly. Like I had, you like, how do you feel? And you look at me, I have no idea how you feel. Hunter, you're going to have to figure out how you feel. And so I really wanted him to build that relationship, and he didn't really get that. And you didn't really get that, which is fine. But I was really rather disappointed. Whereas at the time, and still, I loved my healthcare provider. I liked my doctor. So I introduced you to him. And how's that going?
Pretty much we go together like peanut butter and jelly.
You like your healthcare team?
Really like them a lot.
What is it about them that you like?
The fact that the nurses always have a smile, always laugh and have fun doing their jobs. They, when they need to be serious, they get serious. But if it's just anything that's simple, they just give it to you in plain English. None of the medical long mumbo jumbo terms that you hear on Grey's Anatomy and other shows like that.
Do they take time to listen to you?
Oh, 100%. They have open ears.
Okay. So you're really, it's good.
Yeah.
And I'm very happy that you're assessed. Do you know other ways that people might be able to find adult providers?
Through my chart?
You could use my chart. You could contact the clinic that you go to and ask for their advice, see if there's any who is taking new patients. You can ask other parents.
Oh yeah, I forgot about the other parents.
Especially other parents that have children with special needs, because sometimes they know a doctor who does a little bit better. And you can always talk to your doctor and say, okay, this may not be something you do. You don't see a lot of kids with special health care needs, but are you willing to learn with us? Are you willing to talk to his pediatrician to learn what you need to learn to manage his care as a primary care provider?
You ready to go down a even longer, bumpier road along with us? We have a map.
Well, that's the problem, is we don't have a map. But getting someone who is willing to go along on the journey with you, and having that team, that healthcare team around you.
Yeah.
Now, you don't have many specialists.
Well, would my eye doctor count as a specialist?
Yes,
at this
eye
point in
doctor would
time?
be. You're right. You do.
No, I technically do have a single specialist. It's just more along the general lines of an eye doctor and everything. I don't know what
as a matter of fact,
called.
that is really interesting though, Hunter. I hadn't thought about that. Your ophthalmologist is really a pediatric ophthalmologist.
Yep.
Okay, so when you're there, it's usually kiddos in the waiting room and there's a Disney movie playing. Well, there used to be.
No, they still do
But
play the Disney movie.
her specialty was with eyes that aren't lined up.
Yep.
And so she, even though she was a pediatric ophthalmologist, she sees adult patients just in this really narrow realm. And you're one of them.
Yep, which I am a part of that narrow realm.
So it's not as cut and dry
No.
as the pediatric specialist may still have a specialty in adult care.
Right. Nothing in
But
life
you
is
need-
cut and dry.
That's true, but you need to figure that out beforehand.
Yep.
Decision-making. We already talked a little bit about decision-making.
Yep.
Well, let me ask first, is there anything else you want to say about your adult providers?
Do you want to do the dietitian story this early, or do you want to save that for a little later?
Let's save that one.
All
We'll
right.
save that one for appointment making.
Sounds good.
So decision-making.
I am not that great of decision maker, but I still do okay when it comes to my health.
And how do you make decisions concerning your health? Do you just like, whatever?
No, I use my chart.
Yeah. And how do you use my chart?
Well, in contacting my healthcare team, through making sure I get to my appointments, that I schedule them properly, pay my bills properly for said appointments or other healthcare needs.
And so that's not how that started, though.
No, it started off with you making all the calls at first,
Yeah.
then me sitting in and listening in, and then answering very specific questions, then me answering most of the questions until I was able to do my own calls. And then we discovered my chart. Yes, I am going to promote my chart to the end of the Earth's days.
You weren't really a big fan of phone calls.
Still aren't.
So my chart enabled you to not have to have that stress and anxiety of talking to a person, but you could still make your appointments and keep track of all your tests and everything.
Yep.
That's pretty cool.
Yep. I also discovered Google Maps,
Why is Google Maps so important to you?
because that way I can get to my appointments on time, and it helps making sure that I don't get lost in Madison.
So I'm hearing you might deal a little bit with anxiety as well.
It also helps with knowing anxiety. Yeah.
So this goes a little bit to about me, but this would be a nice time, I think, to, because we've talked a little bit about knowing who you are, knowing your healthcare. Do you want to just sort of explain a little bit who you are and what you're, if you have a diagnosis, if you have different health needs, what about you concerning health?
Well, originally I had a lot of problems with speech, so we set up time with speech therapists and everything. We went to 3 different doctors originally before age 20, where I was diagnosed with autism. I also have a severe, I don't know if it's severe or mild anxiety. It's just generalized anxiety.
It depends on the day and the
Depends on the
situation.
day and situation.
Yeah.
I am also diagnosed with depression and everything, and I actually checked myself into a psychiatric hospital wing of.
Doesn't matter where.
Yep, nope. I just know it was a hospital on the east side of Madison.
Yep.
And got help with them and everything, and had good therapy sessions, and just did well with said therapy, enough to the point where I actually have not seen them in a while, but I've been doing well. The whole darker side of depression hasn't busted its ugly head up in these days of COVID.
So
Fingers crossed it does not.
what have you been doing to stay healthy? How have you taken charge of your healthcare to be healthy?
Mostly just try to eat more in generalized food groups and everything, mostly just simple snacks, eat snacks more often, have healthier lunches and dinners more often, and try and get out more. But again, COVID, thank you very much for that.
But you have found some online groups that have been really helpful.
Yeah, I found a few friends online through a local gaming store and everything. Thank you, Discord, and Roll20 for Dungeons and Dragons.
Mm-hmm.
But overall, just trying my best to get through these hard times.
And we're not going to go into the anxiety and depression, but do you feel if a doctor asked you what it was like when you felt anxious or depressed, would you be able to tell them?
Yeah, I would
explain it to them?
Yeah.
Okay. Because it's important to be able to explain so they know when to help you.
Yep.
Like I know you've had discussions with your doctor about medication or not medication, and you guys come to that decision together, whether it would be helpful or not. But it's important for you to know what your body is doing, how it's feeling. You've explained to me sometimes when you get anxious, and one of the main things we use is breathing.
Yep.
Because you could feel that shortness of breath. So that is really good to understand your body, what healthy feels like, what unhealthy feels like, and then what you can do.
Yep.
So you obviously know who to go see if you want to see your doctor. But what do you do if you suddenly have a healthcare need that's outside of the business hours, like on a Saturday?
Well, that would be the on-call nurse that would be on the back side of the health insurance card that I still do not have.
You know, I ordered you a health insurance card and I don't know where it is. So I will follow up. I will get you a new health insurance card, but don't yell at me about it because I'm not the one who lost the first one.
I know.
Okay.
I still don't know how I lost it.
I don't either, but we'll get you a health. So the back of that health insurance card includes your nurse on call.
Yep.
What else do you know is on that health insurance card?
Well, the health insurance company that you go through.
But that is really important to know because a lot of places you need to go see their doctors to be able to get it paid for by your health insurance. And so knowing your health insurance provider is really important.
Yep. My sister was not lucky in that regard, wasn't she?
She decided to do what was called out of network, and that resulted in a rather large bill.
Yep.
Because she saw an out of network doctor.
Always try to be in network when you can. And if you can't afford it, do out of network if it's a serious injury or something.
Yeah, you still got to take care of your health, right?
Oh, 100% health should be one of your big,
Right.
giant priorities.
So anything about emergency contacts?
Have them in your phone and carry your phone with you. I am not someone who carries my phone around that often, so I do not have my emergency contacts on me 24/7.
But most people do have their phones with them. And so having the emergency contacts in the phone so that if you would be in an accident and you wouldn't be responsive, that you'd still be able to get the help because they would know who your insurance carrier is and they would know who to call.
Yep.
Cool. Talked a little bit about appointments,
Yep.
but I just want to remind people. So at the beginning is you didn't even want to make a phone call to make an appointment.
Correct.
And I know there were years where, you know, even after 18, where we would go to your appointments together. It wasn't necessarily, I was not in the room the whole time.
Nope.
But we would go together. I would support you in that.
Yep.
Again, it's been this process.
Yep.
So do you want to talk about one of the big surprises that came about in this process? Or do you want me to?
The dietitian appointment story.
Yes.
I love this story because it was my first time actually scheduling and going to my own appointment without my parents knowing at all.
True. We were sitting around one day and Hunter puts his coat on and I
Yep,
say,
coat, shoes, grab car keys, had my wallet.
where are you going? Because we generally know where each other is.
Most of the time.
Where are you going? And he's like,
To see my dietitian.
and I of course said, you don't have a dietitian, Hunter.
I do now
So how did you get a dietitian?
by talking to my primary healthcare doctor about how can I gain weight healthy without becoming, well,
Thank you for that. Thank you so very much. Continue.
and he just sent a referral to a dietitian that he knew and just went from there.
Cool. And you still have that contact. So if you wanted to go back, you
Yeah.
could see that dietitian again.
Yep, I still got the contact information for said dietitian and everything, and I still am eating as healthy as possible.
Yep. And you can
So-
always go back to the notes that she gave you
Yep,
to get more ideas about how to eat healthy.
yep.
Cool. And you don't take too many medications, do you?
No, mostly just a combination of multivitamins, vitamin C, vitamin B, and vitamin D.
And did you start off able to just like take them every day when you're supposed to take them?
No.
You're, what? I'm supposed to take something? How did you? So you didn't start at this endpoint. How did you get to where you're taking vitamins every single day at the right times?
Well, through the help of a pill organizer and my
Good.
lovely mother, who is currently sitting in the
No,
room over there.
No need to pull her into the conversation.
Oh, 100% not going to.
But she is the one who set up the pill organizer for you.
Yep. And refilled it for a while
Yeah.
before I started refilling it. And now I'm just taking them every day.
So you start off with your mom having to put the pills into the pill organizer, and when they ran out, she would have to refill it.
Yep.
And now you don't even use a pill organizer,
Correct. I just take them straight out of the bottle.
but you're doing it regularly.
Yep.
So that's, again, that process, that growth.
Yep.
Good job.
Yep.
One of the other things we like talk about, we've kind of talked about this whole time, is putting together this health summary.
Yep.
Understanding what is my health history, what has my health journey been, so that I can then explain it to the next doctor or to the next specialist so that I can understand and explain it. And it also includes things about don't ever try to put a needle in my left arm, only give me needles in the right. Or please ask before you touch me because I'm really sensitive to touch. So what our preferences are, what it is about us that makes us different is that's really important for healthcare teams to know moving forward.
Yep, 100%.
All right, so to sum up, healthcare matters in a variety of settings. Is in the actual management of healthcare, in the clinics you go to. It matters in employment and letting your employers know what accommodations you might need. Accommodations are just things that can be changed so that you can have the ability to do your job.
That stupid industrial dishwasher.
Yes. So you actually had to talk to your employer because you had some lung issues there for a bit.
Yep, had to start putting in an inhaler. Then my supervisor was pretty much like, I could switch you over to housekeeping.
And so that was kind of an accommodation. They didn't just fire you because you couldn't do the dishwasher anymore.
No.
They found a different job that you could do.
Yep, and I spent about another 2 years as a housekeeper.
Yeah. And
before going off to college.
And you had to tell them about what was going on with your health. And you had to talk to them about that.
Yep.
Independent living is you're still in the house, but you're living, kind of independently. Yeah, absolutely.
Semi-independent. I still eat their food and use their electricity and bathroom.
But it's your health that lets you do that.
Yep.
So that's awesome. Your health matters in high school and post-secondary settings. When you were going in person to Madison College, do you remember the kind of stuff that was available to you as a student?
Yeah, they had an entire department for the Disability Resource Center and everything. They also had specific rooms in the library, an entire section of their school for the testing center. There we go. That's what it was titled. For those who needed a more secluded area for test taking. They also had a lot of good groups that you can join and everything to make friends. And just overall, MATC was a very, and still is, an open, welcoming school.
Cool. And you also found out that you could, if you wanted to.
Oh, and counseling services.
Yes, they have counseling services as well. And some minor medical stuff is available there. So you need to learn how, if you decide to go away to college, how can that help you maintain your health? What is it that they have available?
What is a healthy environment within this college for you?
Exactly.
And if they do not have this, is this the right college for you?
Good question. So the rest of the PowerPoints, which I will send out tomorrow to everybody who is here tonight, includes some links to how to put health into the post-secondary transition plan. If you want to know more about post-secondary transition plan, go to the conversations, go to the Transition Talk Tuesdays website, and you can listen to the first night we talked about post-secondary transition plans, as well as then the PTP, as well as the app that's there. Talked a lot about self-advocacy. I love the line that self-advocacy means you get to choose when to pick your battles. Is not everything is a crisis in life.
No, we're just going through a giant world one.
We are going through a giant world crisis at this point, but you should be able to pick the things that are important to you. Someone else shouldn't be the one to say, no, you should really care about this. Self-advocacy means you get to care about what you want to care about, what matters to you. So we have some resources on self-advocacy. Just want to reference a brief timeline of transition.
For once you didn't really tote ADRC.
Well, why don't I talk a little bit about that right now, but really just a little bit, because you're right. There are some people, so like you have what's called private insurance. So right now you're on my insurance. And right now the law says that you get to stay on my insurance until 26. Okay, so you got a few more years. Now, there are also insurance companies that will make exceptions to that rule for special healthcare needs. And so I've been in contact with the insurance company, and now I know the process that if I believe it would be best for you to stay on my insurance past age 26, then I can talk to them about that possibility.
Okay.
Now, there's also some youth that receive public benefits. So Medicaid, Badger Care, they have Badger Care through Katie Beckett. They have a children's long-term support waiver. All these things can be used to help their health, to keep them healthy.
Interesting.
Well, that stops because it's a children's system at a time, but there are benefits available in the adult system. So to access those benefits, you're going to want to go through the Aging and Disability Resource Center.
Okay.
Now, they do more than just benefits.
Oh, 100%.
They also help out in trying to figure out, how you can be helped in what resources are available in the community. Another great resource is the independent living centers are also fantastic resources. But if people have public benefits and they want to continue those benefits, they want to continue our Medicaid, continue our Medicare, continue our children's long-term support, there's steps they have to take and applications they have to take. The Aging Disability Resource Center are the gatekeepers for all those applications. And so starting at around age 17 and a half, you can go and say, okay, this is what I want to try to transition over. And they are the experts and they'll help you with that.
Excellent. So they do not pull a Gandalf and not let you pass.
No, they
They
do.
are
They
the
do
ones
not.
that help you pass.
Yes, very much so.
Interesting.
They help you find the benefits that are going to help you succeed in adulthood. Now, one of the things that comes up when we talk decision making is this whole idea of guardianship. Is who is going to be in charge of your medical decisions after 18? Because automatically at 18, it's you.
Yep.
Now, there's some kiddos who they're not ready yet to take care of themselves.
Or can't
medically.
verbally speak medically either.
Right, that have maybe a different way of communicating. And so there may be times, and even if they have a different way to communicate, it doesn't mean they can't make their own decisions.
Oh, good grief, no.
They definitely should be making their own decisions.
Right.
But there's sometimes when it's safer to have other people making those decisions.
Like mother or father,
Sure.
aunt or uncle,
Yep.
grandparents.
So the most restrictive form of that is guardianship, where basically you lose some of your rights. But there's other ways. There's powers of attorney for healthcare. There's supported decision making, which we'll talk about in a couple of weeks.
Yep.
So there's other ways to help safely make those decisions.
Yep.
But again, it's something
Well,
that
safe as possibly, because we're only human and we will always make bad choices.
do I let you make bad choices sometimes?
Do you want me to get out the list? I will gladly make a list.
But do you learn from them? Are there things that you have learned from making bad decisions that you would not have learned if I never let you make any decisions at all?
Yep.
Yep, there sure are. We've learned that you need to make mistakes. That's
We all
one
need
of
to
the
make
ways.
mistakes.
One of the ways we learn and we grow.
Yep.
But we have to do it safely.
Yep. Stop right
All
clicking.
right, right-clicked again. Also want to include a recommended healthcare transition timeline that we talked about a little bit earlier. Is it starts with just being aware of the policy, aware that transition is taking place. Start to plan at about 14. Start to look at who is the doctor, who are the team of doctors and specialists that are going to take care after 18. That's when you start to go through the healthcare checklist. And this is all in conjunction, hopefully, with what would be called a medical home, with a doctor's office that is there to try to help you in this transition, that understands what your needs are, your unique needs as a person with disability or family with a child with disabilities, until eventually the youth, adolescent grows into a young adult and they're fully integrated into adult care. One area that some people forget is that, especially people that unfortunately spend time in hospitals, is they get used to going to the children's hospital. And you need to figure out what are the rules. When is your child no longer going to be able to be admitted to the children's hospital, but have to be admitted into the adult hospital due to the hospital's rules? And so that's something that people, because you don't want to just all of a sudden have someone say, no, you can't go there anymore. You have to go here, and you've never been there before.
Yep.
That can get really scary.
Yep.
Final recommendations for parents: make a plan, record everything, break things down into smaller tasks. We've talked about that.
Yep.
Um,
Organization. I am not good at organization.
Not the best either, but
You're not more organized than me.
we managed to do it together. Ask questions of other people, get to know other parents, and most of all, be kind and gentle with yourself.
Yep.
You're not going to get it right the first time, and it's okay.
Nope.
Just keep moving forward.
Yep.
So after tonight, hopefully you can, with your youth, with your student, with your son, with your daughter, with yourself, go find a readiness assessment and see about the things that need to happen before age 18. Start those conversations. Check out our website. Talk to the IEP team. Incorporate healthcare into transition planning.
Yep.
Talk to your primary care doctor about, who's going to provide my care after 18. Locate your ADRC. So any one of those is a fantastic action step.
Yep.
But most of all, take a deep breath and stay a step ahead.
Yep.
So also included in the slideshow that I'll get to you is just a bunch of different resources. So don't worry about writing these down. We will get these to you. And then if you have any questions, you're always free to reach out to me. And if you have questions for Hunter, you can reach out to me and I can get them to him.
Yep.
But we do have time tonight. So I'm going to stop sharing and see if there are any questions in the chat, or if you wanted to unmute. We are a small enough group tonight that if you wanted to unmute, we'll be able to see that you unmuted, and you can feel free to ask me any questions or ask Hunter any questions.
And don't forget to count the Yetis.
Yeah, and if anybody has any idea how many Yetis there are, that'd be fantastic. Thanks.
I have a question, Tim and
Okay.
Hunter. So do you have an example of a health summary, or is there on any of the?
That is a fantastic point, Melissa. If you make a note, I will send out a link to a couple different ones.
Okay.
They're sometimes called an about me sheet. The more involved one is called a shared plan of care. And that's used by physicians. It can be used not just in complex care, but that's generally where it started. And it includes the main health issues along with the likes and the dislikes that then goes into the transfer. But yes, we can provide examples of those. Other questions, comments?
As you try and find your mouse.
I know, I've lost my mouse. My mouse has run away.
It's gone up there. It is.
We'll just keep it over here.
Yeah.
Lost my chat box too.
Yes, you did. Yeah, it's the chat box.
Okay. All right. Any final questions, Chris?
Yeah, I know that most healthcare providers, because of HIPAA, won't share information about a patient once they're beyond the age of 18 because they're technically an adult. Do you recommend maybe putting into place something like, having like a release of authorization on file so that a parent can get information to help guide their child?
100% correct.
Yeah.
I am so sorry I missed that, Chris.
Yeah, we actually do have one currently set up for myself to have informational release to both my parents and everything. And no, we do not have any pets, but we do live in a neighborhood that is very dog friendly. We have at least 8-9 dogs in our neighborhood in total.
Sure sounds
Maybe-
like it sometimes.
Maybe 10 if I count the ones living up on
Yeah.
Monroe and everything as well, because they regularly walk their dogs down this way and everything. So
True. You have a lot of dogs around you.
we also have a few random cats. I wouldn't call them feral, I'd just call them neighbor cats.
I
They
would
just
call
walk
them feral.
around.
Yeah.
They just appear out of nowhere.
Mhm. So yes, release of informations when somebody turns 18, that not only helps in communication. Well, one of the ways it helps is just there's some places that won't even let you make an appointment. if you don't have that release of information. And when our kiddos go away to college, they're usually still relying on us to make their appointments sometimes. And so that release of information is really important, just to give you the simple access to make those appointments with the doctor's office.
Yeah. And thank you, Jen, for your amazing comments.
You're pretty good at reading the chat box.
Well, seeing how you care more about interacting with the people, I care more about making sure we have proper interaction.
There you go. Any other questions?
I have my cat with me. See,
Yeah.
Yeah.
What's your cat's name, Lauren?
this is Wishy. He's a tuxedo kitty.
Adorable.
Thanks, it is adorable, but nice and cute.
Cool. Thanks for being here, Lauren.
Yeah.
You're welcome.
All right. If there's no final questions, we will let you know that this has been recorded. We'll have it posted tomorrow or the next day, depends on what tomorrow brings. We'll have the list of resources together and get those sent out to you, and we'll work on posting it to the website. I just had to stop guaranteeing that I'd have it up the next day because I can never be sure what the next day would bring. So any final thing, any other final questions, thoughts, comments? All right, Melissa, you want to take us on home? Oh, I don't know. Do we have any closing slides? We don't need them. Oh, no, this is me. Oh my gosh. I am sorry. This is my fault. I am supposed to put in the link to.
Oh,
Yeah, and I had it pulled it up, and I was all over this earlier. And then I got distracted by my talking.
so
All right.
Tim is going to put a link in for a survey if everybody can fill that in. Helps us be.
Make sure it's set to everything, Dad, before you hit enter.
Oh. Sorry, I almost sent it just to Chris.
Yep.
All right. So there you go. We really do appreciate any feedback that you can give us as we figure out how we can make this better or do this again next year in a couple of years, because it's been a lot of fun so far.
Yeah.
So thank you all for being here tonight. We really appreciate it. And hopefully you learn something new and take one of those action steps and you'll be staying a step ahead. Thanks a lot.
Many steps ahead as possible.
Thanks, everybody.
Bye.
Nice to see you.
Nice to see you guys as well. I love doing these things.